Hey, it's Dr. Rick. I wanted to thank you guys for sending in your HPIs. For the most part, I reviewed them and I found that everything looks beautiful. My suggestion is always to, with repetition, go down the line and keep on asking the same old inquiring questions. You can use that when you're in clinic, but as I mentioned to you, if you do it on the street, in your home, with your friends, anytime anybody has a little sniffle or is coughing up or is holding their shoulder or holding their belly, it's always nice to inquire. And if you start inquiring, that physician mind of yours, if it starts to inquire with the old carts questions to start with, you can't go wrong. This is going to help you with organizing your information and your data gathering. Those of you who are very good with prose or with writing down, I mean, certainly a 3-page narrative is cool, but number one, I'm not going to sit there and read a 3-page narrative. Number two, you're going to exhaust your patient. Then you're going to develop an animosity, and it's supposed to be a patient-doctor cooperative. It's not supposed to be you tire the person out and get them more sick. So in data taking, try to keep it to a minimum until you develop your diagnostic skills, and until you have this wealth of information to know the majority of disease processes that you'll see in the clinic, no matter what specialty you go into. You're going to have to take down a lot of info, but hopefully your organization will be so you can go straight from your chief complaint, your power statement, your bullets, and your HPI, and then further from that. Physical examination will be the next step, but this makes it much easier. I tell all my patients that 80% of your diagnosis, of the diagnosis I come up with to keep my patients safe, comes in the history. In sports medicine, I can make a diagnosis over the phone the majority of times until I get the patient in for a Lockman test or an evaluation of their knee or shoulder, and usually it's pretty right on. The same thing I believe happens when you have the typical presentation in upper respiratory, abdominal pain, headaches. I think 80% of the diagnosis comes from the data gathering. So if you're messed up with your data gathering, then you're going to have to rely more on your physical exam. And if you're not great with physical exam, then you're going to have to rely more on your imaging tests or your lab tests. There's no questions there's great powers in physical exam and lab testing, but if that's all you rely on, you're going to be spending a lot of money, the government's going to be even worse, and you might not have the right diagnosis. So you can save your patients a lot of money. You can save your patients a lot of injury, because unfortunately number 5 on the top 10 killers of Americans is going to be iatrogenic death. That means hospital-acquired injuries. So keep them out of hospital. Keep your information gathering precise, and try to get better as you, I guess, shorten the amount of information. As I mentioned to you, in primary care we are supposed to see patients round robin, so every 10 minutes, unfortunately. That's to break even in business, on the business aspect. Now in integrative medicine, when I spend an hour trying to get to the bottom of a patient with multiple medical problems and get them better, that's a little different, but talk about that in due time. The bottom line is, when you're taking the information, practice it. When you're at home, when you see somebody sneezing, when you see somebody persistently coughing, when you see somebody rubbing their shoulder, when you see somebody kind of hopping, go up to them, if you know them, and ask them, you know, the standard questions. Like I mentioned to you when we were talking about rapport, you're supposed to have that elevator speech rolling off your tongues. Hi, I'm Rick. I work with Dr. Saguil. I am a first-year medical student. Is it okay if I ask you some questions so I can present your case to doc? And if you get that right off the tongue and it rolls off every time, it becomes second nature. When you present with second nature and confidence, your patient will have confidence in you. And if the patient's confident, they'll give you more information without any restrictions. Anyway, same thing with developing an HPI data gathering technique. If you know what to ask, well, if you know the disease process, then you'll know what to ask. If you don't know the disease process, and I don't expect everybody to know all the common diseases and their presentations, Robbins' Pathophysiology is a great book, but eventually you'll get through the 300 pages or so. But until you get to that point, just knowing this repetition is very important. So hopefully you guys are enjoying your time in the clinic. Go to the seniors in case, and email us if you have any questions. If there's a hold up or a question you might have about how should I ask this, how is it tactful. You're going to run into some very complicated patients occasionally, whether they're psychiatric. That doesn't mean psychiatric out of control, that means depression, because at this point you don't have any, with depression you don't have pain. And you have to kind of relate the onset of the disease process with the subtle changes in the patient's demeanor, how they're interacting with the world, what took them away from their job site. So it changes the old CARTS acronym a little bit, but we'll get to that later. And I don't expect you to get to the complicated psychiatric patients, cancer patients, rheumatologic patients till later. For now, just knowing the basics will still help you through the complicated ones as we get to them. But again, hopefully you're getting and enjoying this thing. If you have any questions, email me or email the 4 seniors that are working on our teams in the Indigo team. And always read through, and please try to practice anytime you can the old CARTS application when you go through your questions.